Hello, my name is Corrie McLean and I am one half of Sisters Consultancy.
And my name is Ryan McLean, and I'm the other half of Sisters Consultancy.
Today, Ryan is going to be asking me some questions around the topic of how we can support children and young people with additional support needs to manage their feelings around COVID-19.
And Corrie is going to be answering some of those questions and referring to some key visuals along the way. So let's start at the start. Tell us a little bit about Three Sisters Consultancy.
So my name is Corrie McLean and I'm a trained teacher with years of additional support needs experience, and I work with children and young people. I've worked with parents and carers and also school staff to improve the lives of young people with additional support needs. I am part of Three Sisters Consultancy. We are a small family-run training and facilitation consultancy. A lot of our work focuses around the intersectionality between sexual health and disability, but we also do a lot of work in autism and inclusive environments. We're not psychologists, we're not immunologists, but we do have something to contribute to this discussion around COVID-19 and additional support needs, because we're used to explaining difficult and often sensitive health concepts in different ways that are accessible to all children. I also have lived experience as a carer, and that kind of feeds into all aspects of my work.
So, starting at the start, what types of feelings, emotions might children and young people with additional support needs be having right now during the pandemic?
I think it's a really unsettling time as we adapt to this idea of the new normal. This can be even more challenging for our children with additional support needs. So some of our kids might be more prone to anxiety just in general. Some of our young people might have a less ability to process complicated information about the pandemic, but also struggle to identify their own feelings of anxiety. So particularly as it becomes this new normal. Some of our children might struggle to understand why they're anxious and not have the communication methods or skills to be able to tell us their worries. A lot of our children also have black and white thinking, which makes it hard to work through the kind of grey areas of COVID-19. Some of our children might be more impacted by changes in routine, but also might be more socially isolated without school. We may see more health anxiety, which is the anxiety that centres around health and illness, but we also might see an increase in general anxiety as well.
And there's a lot of talk right now about the idea of trauma and COVID-19. Could you explain it just a little bit for parents and carers? What do we mean by trauma?
Well, COVID-19 has meant a lot of trauma. So it's meant isolation, a lack of control, also a lot of loss. So whether that's of school, of routine, even of loved ones, but it's also meant a loss of a lot of opportunities as well. These experiences can be traumatic for some children, particularly with those already experiencing social inequalities or those who've had similar experiences of powerlessness before. Schools and support services should be taking a trauma-informed support and also have a trauma-informed approach as well. Recovery from trauma is never linear. So for some children it might be complex and it will be individual to each child. But at home, the kind of good rule is trauma-informed approaches aim to do the opposite of what the original trauma was. So for example, when the pandemic started, there was a lot of quick changings with no warning. So it might be then, as parents and carers, we should aim for a slow and steady transition back. There's a lot more information on trauma and trauma-informed practice online, and I also know that Children in Scotland are running a few training webinars on this as well.
Thanks, that's a really good overview. So how can parents and carers recognise anxiety or recognise those big feelings in their children and young people?
I think it's important to look at a lot of different indicators for change, because not every child is the same. A lot of children will be feeling different or maybe acting a little bit different. So it's changes that you maybe would notice, but not necessarily everybody else would. So maybe your child is a little bit more tearful or withdrawn. There might be a lack of concentration or their concentration levels lower. There could be bedwetting for the first time in a few years. Lots of bad thoughts, maybe feelings of doom. Also, some children have a stronger sense of needing control, so they want to overplan, they want to be part of that more. while a lot of other kids struggle with things like clinginess or needing reassurance and being scared of being alone. Some children have repetitive behaviours, and those repetitive behaviours are becoming something that's becoming maybe more of an issue than before the pandemic. One of the things that we want to point out is that behaviours that we see in play are something that if we watch can be really useful for us, because when we see what's happening in play, often that's a reflection of what's happening in a child's brain and how they're feeling. If it feels like your child is distressed or acting out or withdrawn all day, every day, it might be useful to look at things like daily charts or have a wee diary just to dig a little bit deeper and look at what those triggers are. So general anxiety can be tricky because it's not centred on one single issue. A child might just feel a low level of anxiety constantly. And in that case, we might not be able to notice big trends and patterns in the same way. But for most children, there are kind of peaks when they feel very anxious, or you see some of these behaviours, and then dips when things feel okay. So it's useful to know when and how these things are happening. We also recommend using things like emotion wheels or visual symbols for emotions to help children be able to identify and name their feelings and get better at recognising those feelings for themselves. When you're exploring changes in behaviour, it's always good to rule out any physical explanations first. So for example, does stripping down to just their pants and a lack of sleep mean our child is worried about COVID-19, or is it simply too warm in their bedrooms right now? We need to kind of try and identify that. Once we've excluded any other obvious explanations, then it's time to try and really tune in to what our children are experiencing right now.
Thanks. So if a parent is worried or does notice these changes in their child, what can they do to help their kids cope a little bit better right now?
I think the first thing we can say is focus on control, because we know that children respond better when they know what's going on and when they feel like they're in charge. It may be useful to focus on actions, so the fact that we are keeping safe by washing hands, we are keeping safe by wearing a mask, or we're keeping safe by staying home. But it might be also to think about how we can help others, because we know that helping others can, make our mood better. So can we, for example, ring Gran? Or can we sing her a song? Or can we do something for someone else? Because cheering up others does tend to help with our mood as well. It might also be useful to think about and talk about all the qualified people who are working on making COVID-19 go away. So there are doctors and there are researchers and there are NHS workers who are doing the best job they can, and that they're coming up with lots of different ways to think about curing this and making it better. So focusing on the people who have this expertise and saying there are thousands of people all around the world trying to sort this, and they have the knowledge, can really take back that anxiety from our children. Another idea is to work through the worries with children and find paths to reduce that worry. So here's a perfect example of a kind of chart we had with a child. So the child was continuously washing their hands obsessively to the point where they were getting cracks in their skin. And their worry was, my hands are always dirty. So it's important to think about how we can break that down. So what do they actually mean by that? Why is it that they feel like their hands are never clean? So the first thing they were to say was, germs are invisible. Because I can't see the germs, I don't know if they're gone. So how do we get around that? Well, we know that using soap and water gets rid of the germs. So maybe what we do is we have a routine where we wash our hands before and after each meal, and after you use the toilet, and also after we go outside. That will mean that there's actually quite a lot of hand washing going on, but because it's part of a routine and it's something we can control, it might take away that obsessive feeling, because we know the times of the day when we're allowed to wash our hands and the times of the day that it'll actually make an impact in the amount of germs in our hands. Another thing is things like germs give you coronavirus. That might be a thought that they have, but if we're actually doing things like washing our hands as part of a routine, we can refer to things like a routine chart. So if you have a washing hands chart or some sort of visual to show that you have washed your hands a certain amount of times of day, during the day, that can help kind of visual, and you can refer to that and say, well, germs can give you coronavirus, but look how many times you've washed your hands as part of your routine. You're doing a great job making sure you don't have germs in your hands. Another thing that this child said is the TV man says, wash your hands to save lives. This is a child who took that very literally. And that meant that they thought that every time they washed their hands, they were able to save a life. That's logical thinking to that child. So what do we do about it? We don't watch the man on the TV anymore. Just by simply removing something that's easy enough to do, that takes away the stress, is something that can make a huge, huge difference to the health anxiety levels. Another thing is this child had a lot of pent up energy, and they felt like they really needed to, they were quite squirmy, and they weren't used to not having that time in school to run about. So what the child did was a lot of jumping jacks, because that reduced the level of anxious energy they had, and they got all those endorphins from exercise. So that's an example of taking one worry, breaking it down, and then finding scenarios that actually work for you and how you can solve that. We can also use coping mechanisms. So a thing like, you can see the coping skills wheel here, or worry wheels, which can help children choose and then visualize what coping methods work for them. And then take control. So if we are worried about washing our hands, and we've maybe just washed our hands because we've just had breakfast, why don't we go to the coping skills wheels and choose an activity that is something that can help them feel a little bit better. So everyone's coping skills wheel might look completely different. It could be singing a song, their favourite song that they like right now. It could be a hug from mum, or a hug from granny, or whoever you live with. It could be jumping jacks like this child had, where they needed to get that pent out energy. Or it could be something like a sensory toy, something that can really bring down that level of anxiety. What we want to stress with this is, if we're doing something like a coping skills wheel, we want to make sure that the child is encouraged to find a mechanism that they feel worried, that helps them when they feel worried, and praises them when they use it. So if we can, if we can present the coping skills wheel and then we see our child use it, praising them and saying, that's really good, looks what you did. One thing we want to stress, though, is not wanting to focus on just one or two coping skills, because then what happens, for example, if giving mum a tight hug is part of a coping skill, it might mean that when we go back to school, we don't have that coping skill and we're feeling a little bit helpless. So having a variety of different ones that we can transport into different areas of our lives is a great strategy to reduce that anxiety.
That's really helpful. One of the more difficult questions that was brought up in an earlier webinar we had was about a parent whose child had become very worried and preoccupied about death. Are anxieties about death and dying and illness, are those normal in children?
Yes, very, very normal. In COVID-19 reporting, there's almost always a mention about death. And also we want to acknowledge that some families might have experienced the loss themselves, but there are things to remember when we're thinking about death and explaining death to our children. It's completely natural to be curious about death. Children from a very, very young age are curious about death. Either they haven't experienced, or they know someone who has and they don't necessarily understand it. What's really important is, if we are talking about death, it's important to use very clear language. We say things like, we've lost a granny, or granny is no longer with us. But if you have a literal thinker, that might be quite confusing. So we might have to say, granny died, granny is no longer alive. And that's difficult for us as parents and carers, but it gets the message across, because otherwise our children might be thinking, well, we need to go find granny then. COVID-19 has created an environment where death isn't simply for old people. There's a risk for everyone. And it feels like it's our responsibility, because remember, we're hearing stay home, protect the NHS, saves lives. It was our responsibility to make sure that everyone didn't die. Now, most children with additional support needs need just a little bit extra time to process death and to think about death, and accessible information to do that. And it's important that when we open the door to these conversations, that we are able to use some of the resources that we've put, for example, on the slides here. A perfect example is a great book called I Have a Question About Death, and it uses very simple images, and it really helps explain what death is to children and young people with support needs. Where we might feel a little bit more worried about the preoccupations that cause distress to a child or young person around that child. So I think we need to think about when our child is getting to the point where they're so distressed that it's distressing other people around them, it's important to then reach out to somebody. So if you're finding that your child's preoccupation with death is something that's actually affecting other people in your family, please do reach out, get support from the school or whoever it is that supports you, because it's important to get some help at that point. Some children have a preoccupation with symptoms of COVID-19. And this is something that kind of we've experienced as a family. We recommend checking out a North Lanarkshire Council Communication Friendly Environment resource. So we've put it up on our slide here. They have a wonderful checklist, and it has lots of visuals to help children work through some of those physical symptoms, but also think about what might be responsible. For example, if your child is really worried they have a cough, looking at the visual and thinking, have you recently had a run? Do you, for example, have asthma, and is that going to affect the amount you cough? So there's some wonderful visuals out there that kind of just take away that anxiety around some of the symptoms, so that if your child is feeling a little bit more worried about the symptoms, they have a way to do a checklist to make sure that they feel more safe in their own body.
Yeah, those are really helpful. I think we've been hearing a lot about children who are, for example, when they're feeling hot and sweaty, getting very paranoid about having a fever. So just being able to check off the checklist and realise that actually having a cough now and then, feeling a bit hot and sweaty are all completely normal, and not to let that thinking escalate into a sort of anxiety spiral that's not going to help the child. It's going to be really distressing for the family. So what advice would you offer to families and professionals with children who are really struggling? So those children who are potentially very, very distressed, or kids who aren't responding to having those explanations or aren't able to connect to those explanations, what advice would you give?
There are some scenarios where even the most informed or involved parents and carers need additional support. And I think it's okay to ask for that additional support, and it's okay to say you're struggling. So for example, if your child is showing significant and prolonged changes in their mood, please do reach out for support. If the anxiety is stopping your child from participating in activities they used to enjoy, so things that we're talking about coping strategies, if they can't do those activities anymore because of the level of anxiety, that's another time that you might want to ask for some help. If your child is kind of participating in behaviours that harm themselves or others, that's another thing we would stress, please do get some help for that. Also, if your child speaks about harming themselves or ending their own lives, then it's really important you get help. And finally, if your child says they need help, some children will openly say, I need help. So please do reach out to your local services that are appropriate to you immediately if any of these things do crop up.
I think that's us for this session, but thanks so much, Corrie, and thanks for all of our listeners who joined us today.
Yes, thank you very much.